Hi friends, welcome back to my channel. And as all of you know, I do a lot of IVF and lot of fertility work. So sometimes I do come across patients who have submucous fibroids, which are type 3, so partly in the cavity and partly pushing the endometrium. So these are quite challenging, and today I'm going to share this case with you. This patient actually underwent a myomectomy around 1 year ago. She had a large myoma which was removed, and as is the case with multiple fibroids, the recurrence risk is high. But look how the recurrence happened. This fibroid was straddling the endometrium. Can you see this posterior wall fibroid? It measures only zero point 0.8 into 6 millimeters. It is in the posterior wall of the uterus, but it is sitting right at the endomyometrial junction, and half of it is protruding in the cavity, half of it is in the myometrium. Now, this patient is planned for IVF, and I knew that this had to come out. So, we posted her for a hysteroscopic myomectomy. And when we went inside, this is what we saw. So the cavity looks normal, but in the posterior wall of the uterus, you see an indentation, which is because of this fibroid. So can you make out the indentation in the posterior wall? This. So there is the fibroid with the endometrium growing on top of it. I decided to do this with the TrueClear hysteroscopic tissue retrieval system. We use the myoma blade for this. As you can notice, the myoma blade mechanically morcellates the fibroid, and the fibroid blade goes in and out. There's another blade for polyp which goes from side to side. Now this blade is sharper. It is able to cut the tough myoma tissue. So what I'm doing here is insinuating the tip of the TrueClear probe under the capsule of the fibroid. So what I'm trying to do is to remove the entire fibroid from the capsule, so that, and not just the surface which is indenting, so that this does not regrow. Now you can see very well the TrueClear braid is morcellating, and simultaneously it is sucking out the chips which are coming out. That is why it is called as the hysteroscopic tissue retrieval system. So you don't have to insert another, instrument to retrieve the tissue bit. So see, magically the fibroid has gone, but the small white tissue is a remnant of the fibroid, and I have to make sure that I remove it completely. Otherwise, this bit may regrow. Can you see the concave saucer-like impression that we have made in the cavity? That is the fibroid bed, and it was inevitable because part of this fibroid was intramural. Now can you make out the entire fibroid is out? This is the fibroid capsule. We have removed all the fibroid bits, and the rest of the cavity is normal, and this patient can now be planned for an IVF and an embryo transfer procedure, and that is all that is to this case. Thank you so much for a patient listening.